Name is Alirio Olmedo. I'm a registered nurse. I work at LA General here in Southern California. So my interest in workplace violence and behavioral health crisis response comes kind of from my firsthand experience with how unpredictable and high risk these situations can be. Not necessarily just for the patients, but also our healthcare teams that manage these incidences. I've been a nurse since 2010, and my background is in emergency nursing and psychiatric emergency nursing. And here at Los Angeles General Medical Center, we've always had a team that responded to behavioral health crisis. But in 2015, when I became an assistant nurse manager overseeing our psychiatric unit and our behavioral response team, I realized that there was room for improvement. With workplace violence in healthcare on the rise, I saw that there was an urgent need for structured, evidence-based approaches. So I developed this framework to provide clarity, standardization, and ultimately become better, have better outcomes for both the patient and the healthcare teams. For me, the key takeaway from this work is that behavioral health crisis response must be structured, proactive, and patient-centered. The behavioral crisis response model provides a clear framework to ensure that behavioral response teams are well prepared, that roles are clearly defined, and interventions are both effective and compassionate. What makes this model unique is that it applies not only to a team as a whole, but also the individual staff members navigating difficult, disruptive, or violent patient interactions. At any given time, staff will be actively engaged in one of the 5 domains of the behavioral crisis response model. Whether they're planning an approach to engage a patient in crisis, evaluating the effectiveness of an intervention, or preparing and training for future encounters, this structured approach aligns even with some of our current nursing theories, such as Ida Jean Orlando's nursing process theory, which emphasizes that nursing is dynamic, patient-centered, process, and it requires continuous assessment, response, and adaptation based on the patient's needs. Just like the nursing process theory described that nurse-patient interaction as a cyclical process, the BCRM model ensures that crisis response teams are constantly learning, refining, and improving their approach. By treating behavioral health crisis management as an ongoing cycle rather than a static set of interventions, the BCRM enables healthcare teams to remain flexible, proactive, and responsive to ever-changing challenges of crisis intervention. This continuous process of preparation, planning, execution, and evaluation helps ensure that crisis response remains evidence-based, adaptable, and patient-centered, ultimately improving both sides of staff preparedness and patient outcomes in behavioral health emergencies. I mean, ideally, I'd love to see this model widely adopted across healthcare settings, from emergency departments to psychiatric units, and even non-psychiatric areas where behavioral health crisis can occur. More importantly, I hope this article sparks a larger conversation about how we can refine and improve crisis response strategies. I believe that this framework is just a starting point, and with input from others in the field, we can continue to enhance it, make it even stronger tool for improving patient safety and staff safety. So in the near future, I want to put out the next steps for this. To me, would be the standards of practice and competencies for these response teams. The one thing that inspired me to do this is because I thought about, if I were starting a new psychiatric training program, one thing that I would do is, or one of the first steps is, hey, I would go to APNA and ensure that my content, kind of aligned with the APNA standards of practice and competencies for a psychiatric nurse. And one thing that I looked at is no such thing exists currently for these specialized teams. So I think in the near future, I would want to kind of develop those standards of practice and competencies. So, anyone that starts off these specialized teams can have kind of these standards or structure to base their teams on.